Thank you for inviting me and giving this opportunity to talk about what we can do about rural healthcare. Good morning and greetings to the guests of honor, the President, Vice President and Governors of IMC, members of the organizing committee, and all the dignitaries and participants in the Healthcare Summit today. Imagine you're in a large city, say Mumbai. You have a family member who's in bad shape due to COVID and who needs to be in an ICU. But forget about getting an ICU. There are not even regular beds available anywhere. You have no access even to an oxygen cylinder while you wait for a bed to appear. Now you manage to get a bed, but the ambulance is going to take 6 hours to reach. You're desperate, you're worried sick, you're inconsolable, you're frustrated. Now, this is happening in many households across cities in India as I speak, despite the best effort of the government and hospitals. Friends, you now realize that access to healthcare matters more than anything else you valued all these years. Now, listen carefully to this. This is happening in rural Maharashtra, in fact, all over rural India, not just during COVID, but all year round. Year after year, and for the last so many years. It is much worse than you imagine. People suffer when they don't need to. People die when they don't need to. People have to go to private hospitals which they can ill afford. And they even go to quacks. The IMC Chamber of Commerce felt that it's urgent to do something about this and wanted to assist the government of Maharashtra with a way to solve this problem. So they approached Avalon Consulting to study the situation and recommend a solution to this problem. I was delighted to offer our services pro bono. So our goal at the outset was to substantially improve access to good healthcare in rural areas and to keep it affordable or even free. It was very clear soon after we started work that the government is trying very hard, but there are problems on many fronts and the challenges are daunting. For many reasons. They have implemented a very good concept of rural healthcare. One tertiary health hospital in a big city takes care of many secondary rural hospitals. Each such hospital takes care of a number of primary health centers, and each primary health center takes care of a number of sub-centers at the village level. So there's a logical progression for a patient from the sub-center all the way up to a tertiary hospital in the city, depending on the complication which arises at each level. So in theory, it's a brilliant idea. And they've built infrastructure across the country, across the state, equipped them with not just hardware, but also software to manage their operations in the manner in which the government wants it to be. And that's so far good. But as is often the case, the best of ideas become victims of the devil of implementation. Starved of financial and people resources for a prolonged period, this system, which is meant to be good, is suboptimally managed and has largely failed to deliver. India is not the only country where this is happening, but we are worried about India right now. Periodic attempts to revive the system have not succeeded to provide reliable healthcare to rural folks. So we looked at various solutions and concluded, after doing the diagnosis, and concluded that the best solution would be one where we can combine the government's infrastructure and ability to govern with the private sector's ability to manage resources effectively and efficiently, and with the desire of some of them to give back to society. So the private sector could adopt a cluster of a rural hospital, a number of PHCs under that, and a number of sub-centers under that, and reselect that healthcare cluster by restoring the infrastructure, upgrading the equipment at their own cost, and recruiting personnel to operate the healthcare center efficiently. The patients continue to receive free treatment as at present, because you're following government rules, and the government of Maharashtra would reimburse the operating expenses every month. There would be no profit for the private sector in this PPP arrangement because it's meant for goodness and for improving things. So it's like a CSR activity. We were encouraged to find something very similar in spirit in the Mahabaleshwar Rural Hospital and its associated primary healthcare centers and sub-centers, which was a joint initiative of the government of Maharashtra and the Red Cross. And the Red Cross roped in Mr. Jaisingh Mariwala, an industrialist, and his group of donors. The rural hospital in Mahabaleshwar, which was defunct for 25 years, was resurrected in 6 months flat. The new avatar is so beautifully equipped and so well equipped and so clean that I'd love to be admitted there if I had to fall ill. It is cleaner than 95% of the hospitals and nursing homes in Mumbai, far cleaner. It would take care of affordability because it continues to provide this services despite the upgrade and better quality of services. But what about access? Now, coming to access, our goal is that the rural patient should get access to healthcare, which on some parameters is even superior to what their urban cousins get. For instance, a common man in a city goes to a doctor for something more than a cold or a fever. He is often recommended some tests, or he is passed on to a specialist who will also recommend some tests. And by the time the tests and consultation's over, it's about 4 to 7 days before the treatment starts. We want a solution that will just take 2 hours, not 4 to 7 days, in the rural areas for most diseases, from consultation, diagnostic, and medicine in hand. Now, it looks like a tall order, 2 hours versus 4 to 7 days, but this can happen only if technology is adopted. So in our report, we have described a couple of types of digital platforms that could have an electronic inpatient information database, audio and video connectivity which allows telemedicine. This is not very expensive. Okay, it costs about a lakh a month. They can be as an operating expense, and it will serve a huge number of patients. And on that platform would sit various applications which are connected to devices, which are again not very expensive and which are available in India because there are some very, very innovative startups and other companies, mature companies, which are making these available, both the hardware and the software. So I'll give you one example. You can easily get an inexpensive artificial intelligence-based digital pathology machine, which can do a blood test, and that blood test can be done by an ASHA worker, not a qualified pathologist, and it can deliver up to 35 parameters. Okay. Now the beauty is that the results will be out in 10 minutes, and the results will automatically be transferred immediately to the platform, and the doctor can see it on his screen along with the patient's history of illness and medicines taken so far and the clinical discussion there and the blood test report, all in a matter of 10 minutes. And therefore he or she can diagnose and recommend medicines to be dispensed at the same place. If there is a complication and he needs guidance, he can just tap into the platform and connect with one of the many specialists who are sitting in some other cities who have made themselves available because they want to do something in their spare time for rural India. And we know we are connected with many people for that. And get advice on what should be doing. Now, this doctor sitting far away in Mumbai or Pune can actually see all the same thing that the other doctors saw, including the blood test report, instantly, and therefore able to diagnose and guide the doctor in the rural area. So the doctor also benefits from the experience. He's not anymore in the boondocks, literally, because of the connectivity. And the entire cycle time could be 1 to 2 hours, depending on the queue at the primary healthcare center. A common man in the urban Maharashtra cannot hope to get anything close to that in terms of speed and quality, and that too free. So we're going to up the ante. Now, Piramal Swastha, which has developed a well-designed platform that meets our requirements, were prepared to do the pilot study for 3 months free of charges. The cluster would have to pay only for the technology vendors on their platform, And we have recommended how the government could roll out this solution across the 36 districts of Maharashtra. IMC and Avalon Consulting will be happy to discuss this in more detail with the government of Maharashtra. And likewise, I would appeal to the socially minded business groups in Maharashtra to proactively engage with the government of Maharashtra to adopt a cluster. It is now up to the private sector and the government to take this forward. If the twain can meet, it will herald a new beginning in India's healthcare system for rural poor, not just Maharashtra. A big thank you to IMC Healthcare Committee members, experts from various technology companies whom we consulted, Piramal Swasthya, Father Tommy and his Retros team, Mr. Mariwala and his team at MG Rural Hospital, and the Avalon team, especially Nitisha Dhawan, who have contributed significantly to this paper. I have one more pleasant duty to perform. Dr. Mukesh Batra has just released a book on the wonders of homeopathic treatment. Here it is. And you can get a free copy by messaging him. And copies of our white paper are also available free of cost to whoever is interested. Thank you very much for your attention.